Welcome to FitTech Videos. In this video series, I want to take you through parent-child releasing, so how you can help your children. I see a lot of kids, a lot of parents bring their kids to me for releasing, and it's very effective. But I do feel that quite often a lot of it can be done by the parents. It's a lot more cost effective, and then when there's something more serious, then you can always bring them in and I can go deeper. If you do a daily or every second or every third day you do a good release for your kids, it's really will make a huge difference. Thanks to my little princess Jewel for being our first volunteer to help me with this. Jewel's 5 years old, and she is quite young, and I would probably suggest that you can start younger, but I think from 5 upwards it's a good time to start doing some light triggering. So I'm going to show you just a basic full body release that I will do with Jewel. She loves her triggering, don't you? And so it's a big misconception that people think, oh, kids, how can they be tight? They don't do much. But just because they're kids doesn't mean that they don't have muscle tightness. Muscle tightness, it affects them, and especially from her age now, they go through growth spurts and they can start getting pains in their knees and in their feet and their hips. And also, if you do regular releasing, it actually stimulates the growth pattern so that you're not going to get muscles working imbalances that develop from this age. So often grown-ups that I see that are 40, 50, 60 years old have developed issues because they were not released when they were 5 years old or 6 years old. Because a lot of people my age, from the 40s up, when we were young, there was no such thing as your parents releasing you or even a therapist releasing you, unless you had a major problem or you've had an operation or something like that. And it's quite important. I feel it's really important. And it's difficult to bring your kids in for therapy regularly because it costs a lot. So the goal of this video is to give you the tools to be able to help your children to just be able to go and play and grow so that they don't have these little niggles that they don't need. Great. So with Jewel, we're going to start, and I'm going to just show you some basic things that you can do. It doesn't have to be too in-depth. What we'll do is we'll start with the quad. So we'll start with the legs, and we'll start with the quadricep muscle. Now, one thing I give a bit of a smile, because one thing to remember when working with kids, the biggest thing you must remember is they don't know how pain really works yet. They don't quite understand pain. They don't understand what pain is in their body. And the reason why I say that is obviously when they get hurt, they know they've got hurt. But when I'm triggering there, you don't feel sore, do you? You feel ticklish, don't you? Yes. So their body protects them. So anything you do, if it's too ticklish, understand that it's actually sore. The body's actually trying to pull away. So it's important to do it systematically and evenly so that you're not causing too much ticklishness, because ticklishness is actually a pain response in the body, but just enough that they can handle, right? And if you carry on going through that ticklish barrier, it'll actually start getting sore. So remember that if ticklishness is not actually fun, it's actually a bit of discomfort. It's okay to do a bit, but don't go too much on that zone. Right, so because of that, they can't accurately tell you, oh, it's too hard or it's too sore. They just know ticklishness. Here and there, they'll be able to tell you. And of course, from an individual basis, it's a little bit different. So what we're going to do is we're going to ask Jewel to lift your leg up. Thank you, my guys. Okay, so what we're going to do is you hold the knee, you support the leg in this position, add a little bit of movement. I find if you add movement, the body is far more willing to get you to release. Then what you're doing is just slightly straighten the knee, but not a locked knee, just a slight straight knee, and then you're just going to be triggering the leg, and that's ticklish, eh? And then that's what I'm talking about. So you go according to how she feels, and do a little bit at a time. Do like 2 or 3, back off. Add a little bit of movement to get it released. 2 or 3, add a little bit, relax a little bit. Now you can add the dreaded claw, the claw, right? The dreaded claw is very ticklish, and I think if you, as an adult, remember back when you were a child, your brother or your father or someone always did the claw by the knee. So I see a lot of clients that come in, and as soon as they bring the claw to the knee, they're like flashbacks of when they were tickled. So when you do this, just very gentle, add a lot of movement. That's not too sore ticklish. Too sore ticklish. That's not too sore, is it? A little bit ticklish, eh? That's what I'm trying to say. Right, so a little bit of squeezing. And what you can do is, as the body feels comfortable, it will be ticklish, but as the body feels comfortable, it'll allow you to do a little bit more. That's not too bad, is it? Fantastic. So that's into the quad. Now, you can go a little bit into the adductor. So with the flat fingers, you're just going to stimulate. That's not too ticklish. No, so what you can do is add a little bit of rotation of the hip, add a little bit of there. Oop, that's a bit ticklish, eh? And as it's a bit ticklish, you just back off. That's the best thing to do. Just go there, not too bad, hey? And then what you do is you can kind of rotate a little bit in, just gentle movements. Make sure that they're comfortable at all times. You comfortable? Good. Then you kind of grip it, so you kind of put your fingers on the inside of the thigh, pulling it up and then straighten the leg. Pull it up, straighten. Pull up, straighten. Fantastic. And that helps to, and then you can add a bit of movement again. So a bit of rotation. So as you rotate it in, you pull it back, you straighten the leg, and then you work it again. That's good to get into the adductor. Now with them so small, you can literally grab hold of the leg, then grab hold of this hamstring muscle. You feel that? A little bit of a trigger. So always do a little bit of stimulation. And the more you do, the more ticklish it is. So do 2 or 3, back off, do 2 or 3, back off. Then get a grip and then straighten it. Get a grip and straighten it. So holding onto the muscle and straightening. I find that movement, it makes it a bit easier. Hey guys. Yes. So now bend the knee. Then in this position, very similar to how we work with adults, the biggest difference is obviously the fact that they're not going to always tell you where the spots are. So basically, you just got to run through. And normally where the most ticklish spot is, that's where the most tender spot actually is. So now you're going to go up and down. You feel that? That's quite sensitive, eh? But not too sore. Good. And then, so you can go from the bone away, so a little bit over the muscle, that's a bit tender, hey? I can feel that, and then right in there. So just with 1 finger or with 2 fingers, they're so small, you don't have to go too hard. Then, bend the knee for me. In this position, you can hold on to there and work the foot yourself, or you can ask them, work the foot for me. Up and down. There we go. That's not too sore. I find if you give them things to do, it's a lot easier. Then you can go into the calf, work the foot for that. That's good. That's a bit sore, but not too sore. Good. And they're working now. Good. And in that position as well, you can work the calf. Remember, the calf is very sensitive, even in the wee ones. So don't push too hard. Oh, that's quite a tender spot, eh? But not too sore, hey? And it's also good to grab hold of the foot and add a bit of movement. So you can be quite firm, not rough, quite firm. And also what's very important, right in there, you love the feet, don't you guys? That's so tender. Not too bad?
Tender.
Just tender. Okay. Right there, hey. So get the thumb under the foot and just kind of stimulate. Work the foot side to side and up and down. Not too hard, hey? Not too sore. Fantastic. And you can feel there's a lot of tenderness under that foot. Right, then very important is to stimulate that psoas. So bend the knee for that. Put the knee on there. Okay, let's do it this side. Put the knee there. So what you're going to do is, obviously I'll normally stand on the same side as what I'm working on that side, but and also for the case of these videos of the kids, I've put them on my massage table. Now, you can do this on a couch, on a bed, on the floor, whatever is comfortable for you. I just thought that for the videos, it will be easier for you to see what I'm doing if I'm on the massage bed. So what you can do, get them to bend their knee, and then just you feel for their little pelvis there, and right on the front of the pelvis. Remember, all these touches that you do are going to be sensitive. So what I like to do is kind of like get my hands in there generally. So just a soft touch everywhere, always holding on somewhere else to kind of get them comfortable. And then just slowly feel, if you go and poke too much, it's going to be too ticklish and they're going to tense too much. So just there, and then basically holding on 2 fingers from the, or probably just a finger, they're so small. And just stimulate between the belly button and that point of the pelvis in a slight diagonal movement. So about a finger or 2 off the point of the pelvis. You want to just stimulate there and ask them to lift the knee to the chest and relax down. Good. And lift the knee to the chest and relax down. And now I want you to take the leg all the way down. So lift it up first to the chest and all the way down. Good. That's a good way to stimulate that psoas. And also just to release it a little bit. And it's very good to get their psoas, the hip flexors, stimulated, especially girls. Girls tend to get that bit of a hollow back, and because they get very tight in the quads and in the psoas. Girls slightly have wider hips than boys, and that tends to be more of an issue. That's one of the things I think. It's one of the reasons I think, because it tends to happen more in girls than in boys, but it can happen in boys as well. So yeah, that's basically the legs of releasing. So we went through the quad, the hamstrings, the adductors, the anterior tibs, the calves, and the feet. And very importantly, the psoas. Now, the psoas muscle is, as I showed you now, it's a difficult muscle to actually get into, but stimulating it is a very good way of doing it. Then another way of stimulating is just off the pelvic bone. Put your 2 fingers and lift the legs straight for there, and relax. Oh, just straight up, straight like that. Very good, and relax, not too sore. And there. So I'm not pushing hard at all. Lift up and relax. You feel that? One more, lift again. Good. So just getting them lifted straight while stimulating tells the brain to use that psoas muscle, automatically that psoas releases, and then the rest will also relax. So that's a good way to do the lower body for kids from 5 years old. Thanks to Jewel for being our guinea pig. In the next video, we'll do the upper body for the kids. Thanks for watching.